Previously, in the CNS Pharmacology Masterclass, we talked about the anti-epileptic drugs classification, and we mentioned that we have a first-generation anti-epileptic drugs, which are also called the classic anti-epileptics or the older anti-epileptics. And we also have a second-generation anti-epileptic drugs, which are also called the newer anti-epileptics. Now, the Lamotrigine is included in the second-generation anti-epileptic drugs. Other examples of the second generation include the vigabatrin, the topiramate, the levetiracetam, the gabapentin and pregabalin, and the tigabine. Examples of the first generation include the phenytoin, the carbamazepine, the valproic acid, the ethosuximide, the phenobarbital, and the benzodiazepines. So in our talk about the Lamotrigine, we will start with an overview. So a famous trade name for the Lamotrigine is the Lamictal, and this is how the packaging of the Lamictal looks like. And Lamotrigine is one of the most widely used and prescribed anti-epileptic drugs in treatment of focal seizures. And it was first used in 1990 in Ireland to treat epilepsy. Now let's talk about the mechanism of action of the Lamotrigine. So it works by blocking the voltage-gated sodium channels in the brain. And this is similar to the most of the first generation anti-epileptics, like the carbamazepine. It also works by blocking the voltage-gated sodium channels. Now, the Lamotrigine also works by inhibiting the presynaptic release of glutamate and aspartate. And glutamate and aspartate are excitatory neurotransmitters. So Lamotrigine also works by blocking these neurotransmitters to treat seizures. And we mentioned before that to treat a seizure, we either have to block the sodium channels or we have to enhance the inhibitory neurotransmitters, which is the GABA, or we have to block the excitatory neurotransmitters, which are the glutamate and aspartate. And Lamotrigine does two of those three. It blocks the sodium channels and it blocks the excitatory neurotransmitters. Moving on to talk about the therapeutic uses. So Lamotrigine is effective in treatment of focal seizures, as we mentioned before, and this is same with the carbamazepine. Carbamazepine also very effective in treating focal seizures. And Lamotrigine is also effective against idiopathic generalized onset tonic-clonic seizures and Lennox-Gastaut syndrome. It is also effective in treatment of absence seizures, but not the same efficacy as the ethosuximide or the valproate. So the ethosuximide or valproate are better in treating absence seizures. But Lamotrigine is preferred in pregnancy due to the low teratogenic potential for this medication in comparison with the other anti-epileptics. Now, Lamotrigine and levetiracetam are both the best in treating seizures during pregnancy because both of them have low potential for teratogenic effects. Lamotrigine is used off-label in treatment of bipolar disorder, fibromyalgia, schizophrenia, and depression. Now let's talk about the adverse effects. So Lamotrigine is generally well tolerated, but it may lead to a headache, nausea and vomiting. It also may lead to diplopia. Diplopia is double vision, meaning the person sees two pictures of the same picture, like you can see in this example here. Lamotrigine may lead to a skin rash, which is allergic in nature, and this skin rash may rarely progresses to Stevens-Johnson syndrome, and this risk for this type of side effect is much higher if the lamotrigine was combined with the valproic acid, because the valproic acid also lead to the Stevens-Johnson syndrome. And this is a picture of a patient with the Stevens-Johnson syndrome. Lamotrigine may also lead to insomnia. Now, this is the opposite of the most anti-epileptics, because most of the anti-epileptics cause sedation instead of insomnia, but lamotrigine causes insomnia. Moving on to the pharmacokinetics. So lamotrigine is available as oral formula, and the oral formula is well absorbed with bioavailability of 98%. And regarding distribution, the lamotrigine binds to proteins by 55%, and the rest is distributed to the tissues, especially the brain, where it exerts its effects, and its volume of distribution is 1.2. And since the volume of distribution is less than 10, meaning when there is toxicity with this medication, it can be removed with dialysis. Now, lamotrigine is metabolized by glucuronidation in the liver and excreted in urine, and it is eliminated by first-order kinetics with a half-life of around 24 hours. Regarding the drug interactions, so the lamotrigine is commonly combined with valproate to treat different types of seizures, and the valproate inhibits the lamotrigine metabolism, leading to increase of its drug levels and its half-life. So if we combine the valproate with the lamotrigine, we expect the lamotrigine drug levels to increase and its half-life to increase also. So the lamotrigine dose should be reduced if it is combined with the valproate. And with that, we reach the end of this video. Thank you guys for watching. Please make sure to like this video and comment your ideas and questions. And this video is a part of a bigger class. It's called the CNS Pharmacology Masterclass. It will appear on your monitor right now if you want to check it out.